Bush.
Second.
All right, it's been moved and properly seconded that we accept the minutes as published. If there's no debate, we're ready for the question.
Dr. McDougall?
Yes, ma'am.
Dr. Ray?
Yes.
Dr. Rosemary Jackson?
Yes.
Dr. Miller?
Yes.
Commissioner Alon?
Yes.
Dr. Glover?
Yes.
Dr. Orto? Mr. Gregorio?
Yes.
Mr. Brown?
I think he said yes, but he's muted. You're muted, Josh. Okay.
Thumbs
All
up.
right. Thumbs
And
up.
Dr. Laurent Jackson.
All right. Very good. Thank you all. We have Liz Stevenson, who is serving as our administrator of this meeting. Do we have any public comments for today, Liz? To your
We do not,
knowledge?
sir.
Okay, very good, very good. So we'll move on to the next item on the agenda, which is staff and program recognitions. I'll give the floor to Director Jenkins for that.
Thank you, Mr. Chair. Good evening to this illustrious board. I'll be very brief. Just want to really recognize the leadership team of the Durham County Department of Public Health. They have been working and just really availing themselves as we go through this transition, as evidenced by Deputy Director Liz Stevens pitching in to assist this great board with this meeting. I couldn't be more proud of them. Today we had a leadership retreat, which was one of two conducted with our region. And it's always a great time to get away from the building and to enhance our skills. And we're very fortunate to have maximum participation from the leadership team. And as I said via email, even in absentia, I'd like to lift up and recognize Ms. Donna Murphy, who is the new Senior Administrative Officer to the Public Health Director. We so wish that she could be here to meet you all and to conduct business, but she is out recovering from a medical procedure, but we are most fortunate to have her. She is no stranger to this agency, and she means a whole lot to this agency. As articulated inside my missive to you all, she's done a whole lot with COVID and our HR functions and just really being that individual who we can count on to get things done. So I look forward to her providing great service to this board and continuing to work for our agency. Back to you for Dr. McDougall.
Thank you, Director Jenkins. All right, so we'll move on with the agenda. And we have our budget and fee schedule overview. Micah Gwendon will offer that presentation for us at this time.
Thank you. All right, you should be able to see my screen. All right, thank you. Good evening, board. I am happy to be with you today to share the Department of Public Health's requested budget for fiscal year 24-25. This is the culmination of work that our finance team, as well as all the leadership team members that Director Jenkins was just shouting out, who are on the call this evening, and even some who aren't. We have all been engaged in this work since December. So I'm very proud to stand before you and offer our work. This has been a very unique budget season. So due to expected slowing county revenue and increasing have-tos at the county level, our initial charge from county management this year was to submit a flat budget in our operating expense lines. So this directive applied to operating accounts that are county supported. So personnel lines, which come directly to us from HR, and our grant funds were excluded. So any major changes that we wanted to make to programming needed to be reallocated from existing funds already included in our base budget. So later on, we received another direction to include possible 5% and 10% cut scenarios. So I have 12 slides this evening to illustrate our budget submission. So DPH would like to request a county appropriation of $26,989,795 for fiscal year 24-25. This is an 8.7% increase from the current year. This represents $2.2 million change from the current year's originally approved budget. The major drivers of this change are $1.8 million in personnel costs, $496,966 in obligated contract services, $107,750 in advertising, $64,961 in pharmacy supplies, $38,289 in laboratory supplies, as well as decreases in software and miscellaneous supplies. The total change in revenue is $269,059. Notably, one large federal grant in health education is ending this year, but Medicaid revenue is expected to increase across most of the program areas in fiscal year 25. And the DINE program received an increase of $241,117. So this request does not include any increases to the county portion of our operating lines, except for those we are contractually obligated to make. Within the Department of Public Health's budget, as you all know, we have many grants. So our operating requests for next year went up and down, reflecting the changes in those 30+ grants. However, as for the county-only operating costs, we submitted a flat budget per direction of management. In terms of our FTEs, the Department of Public Health picked up 2 during this fiscal year, our disease intervention specialists, which are grant supported, and we are not requesting any new FTEs for next fiscal year, so we'll remain at 245.07 FTEs. We have 3 reallocation requests for your consideration. All use currently budgeted resources, so we are not requesting any additional county dollars. At the top of our list is to continue the work of Bull City Strong as their federal grant, as I mentioned, ends this year. That grant is from the Office of Minority Health, and it's been a 3-year grant. This program addresses health disparities in Durham County and the historically marginalized populations. To minimize the burden on county resources, the Bull City Strong program secured $100,000 in grant funding from the National Association of County and City Health Officials, or NACCHO. Backed by positive program outcomes, our request is driven by the need to continue proven interventions such as comprehensive bilingual health literacy training cohorts, community outreach and vaccine events, and mass media campaign messaging. You can see on the slide some of the metrics for these activities from the past 3 years. Sustaining Bull City Strong not only aligns with the department's commitment to health equity, but it also ensures ongoing community empowerment, workforce development, and tangible economic impact, evidenced by educational advancements and successful employment outcomes. The reallocation request maintains only the most essential elements of the program that have shown a lot of engagement and impact during the 3-year grant cycle from OMH. So the costs included are to continue support for the health literacy program manager and the public health education specialists in the program. The reallocation will also allow for continued contracting with community-based partner organizations such as Latin 19 and some operating costs. We're requesting to cover these costs of $222,889 by using 2 vacant senior health nurse positions from the school health program. No additional cost to the county is requested. Priority number 2 is to be able to continue the screening of asymptomatic trichomonas. Within our lab, the FDA has recently approved the trick test panel to include patient-collected vaginal swabs and both male and female urine specimens. So we're able to run this test in-house on our Hologic Panther analyzer. And so request for this reallocation is to be able to purchase lab supplies and offer this screening to asymptomatic patients to sustain a healthy community. With this preventative screening measure, affected patients may be diagnosed and treated prior to showing symptoms, which will in turn reduce the spread of this common STI and reduce healthcare costs in Durham County. This initiative would cost $80,841 in lab testing and supplies, and this initiative is revenue generating. So we estimate $49,920 per year from Medicaid and self-pay patients in STI, family planning, and maternal health clinics. To cover the rest, we would like to reallocate $30,921 from other operating lines in other areas of the department. Our third priority for reallocation comes from the Adverse Childhood Experiences Program, which is growing to meet the needs of Durham County. This request is to reallocate a part-time vacant position in nutrition to the ACES program to achieve the goals of the program and ensure programmatic integrity. So with some part-time support, a community health worker can support partner engagement, develop a process to build community capacity, and address adverse childhood experiences in communities most impacted. The cost of a 0.53 FTE community health worker for ACES program support is $35,953, and we'd like to cover that by reallocating the 0.53 FTE position from the nutrition division, which has been hard to fill historically. Also, no additional cost to the county here. Now I want to briefly touch on our requested fee changes. The budget for next year includes 239 fee changes, which are recommended by the department's fee and coding team. 84 of these are dental fees that we would like to increase to 60% of the 2024 National Dental Services Advisory Study, with the geographic multiplier added, and another 84 are proposed to change minor adjustments from vendors and the Center for Medicare and Medicaid, CMS. The remaining 71 are a combination of $0 fees that we would just like to put on our public-facing fee schedule, some deletions for those that are no longer applicable or allowable, changes in name only, and a few new fees. The total financial impact is projected to be an increase of approximately $146,938. Lastly, I want to touch on the impact of the possible budget reductions to public health. So the county operating funds that are in play with this reduction scenario is $4,870,652. 5% of that is $243,533, and 10% of that is $487,65. We asked all programs to trim their budget by these percentages. And so this list here is not inclusive of everything that would be required to be reduced in this situation, were it to come to this, but I just want to hit the highlight points. So our 5% cuts would include travel and training reductions, some uniforms for environmental health staff, medical supplies and contracts for dental and medical services, medical equipment maintenance, and food for volunteer community partners at in-person meetings, for example, the Partnership for Healthy Durham. Our 10% reduction would include everything on that 5% list and also some contract reductions or cuts. So contracts for printing and mailing educational materials. We have a contract with the Duplex Housing Unit that houses medically vulnerable unhoused individuals who need to be quarantined. We would need to cut some contracts with some community partners that conduct Comunidad Latina and Black or African American samples of the CHA survey, as well as a contract for business continuity planning and tabletop testing for disaster preparation. With a 10% cut, our on-site water protection annual mailing and survey would be eliminated. Advertising and outreach to underrepresented communities would decrease. 1 vacant school health nurse position and 1 vacant processing assistant position would be cut as well. So essentially, these all amount to a decrease in staff and community resources, which may impact staff morale negatively and decrease community engagement with the department's programs. We would be scaling back to bare bones, so to speak, and that was our directive. For our medical services, I will mention that we would rather cut a couple vacant positions rather than further cut operating lines, as those would have to be cut in immunization purchasing for RSV, COVID, etc. Those immunizations cannot be purchased with grant funds, and so cutting those in our program would have detrimental effects to maternal health, family planning, and immunization clinical operations. Lastly, and very importantly, I did mention to county management that any cuts to our medical or dental clinical areas would also have a negative impact on revenue, as services in dental and medical clinics, as well as environmental health, of course, are revenue generating. So we tried to trim in other places, but if Department of Public Health is cut at these percentages, we would be pressed to keep clinic numbers at current levels, as staff are already scrambling to find funds to purchase certain items like vaccines that have to be purchased with the county dollars. So with that, I want to finish by thanking my colleagues for their contributions and hard work in this exciting, no dull moments budget year. Of all the finance jobs I've had in my career, this Department of Public Health staff and managers, division directors, as well as Director Jenkins and our deputy directors are the most engaged and knowledgeable about their budgets. They've worked hand in hand with me and my team on this budget project now for a 2nd year in a row, and they've done a fantastic job pivoting with all that has come our way these last few months. They've volunteered resources from their own program areas when they could benefit another program who was in need, which to me is a sign of the true public servants that they are. I thank each of you. Happy to entertain any questions that the board may have at this time.
Yeah, hey, this is Dr. Jackson. I have a question, but I might need to ask you to go back to remind me. The school nurse positions, I think there were 2 that were unable to be filled, and the monies were reallocated to, tell me again where?
One is, this is just a possible scenario where
Okay.
with the reduction of a 10%, should management and the commissioners decide to go that route, one would be in that possible scenario. And the other was in towards our Bull City Strong program here.
Okay. Okay. All right, thanks.
Sure, and I will say on the school health, let me make sure I've got my notes here. 1 second, please. So for our school health program, we cover 45 DPS schools. And even given these cuts, that would have 1 nurse per 2 schools. So the best practice model is a 1-to-1 model, but we have been operating with 1 nurse to 4 or 5 schools. So 1-to-2 ratio would be an improvement.
Improvement, yeah.
One
great.
that management felt was definitely feasible.
Okay, all right, great, thank you.
Yes, ma'am.
The chair recognizes Commissioner Alam.
Thank you, Dr. McDougall. Thank you so much, Micah, for this presentation. I'm just wondering, the slide with the overall 8.7% increase, I just want to confirm, how much of that is salaries and benefits, and then how much of it was separated out to operational? Just wondering, because I know that the county staff, budget staff had already presented to commissioners about expected salary and benefits increases for all departments. So I'm just wondering, separating that out, what the amount is left then, because that's really what the commissioners are gonna see.
Yeah, so the personnel increase from this year to next year for us, for our department is 1.8 million.
So then it's like 1.3 is left over as the operational.
Yes, I'm doing the
Okay.
2.2.
That's good to know, yeah, because I think,
Yeah,
So-
about 2.4.
okay, so yeah, commissioners are already basically then aware of the 1.8. The 1.3 is the really the ask, I guess you could say, that'll be coming to us since we've already been kind of expecting the 1.8. Okay.
Yeah, and I think one thing, and I know everybody on this board is aware of this, as well as county management who work with us, but a lot of our expense lines are tied into grants for mandated services. So that's what makes our percent. So while we're reflecting, you know, we may reflect an increase on that operating line, not all of that is county funds. Much of it is grant funds that for mandated services. So essentially that can't be cut.
That's good to know. My second question, and this is more like a policy, I guess, bandwidth question. So Director Jenkins, feel free to answer this, like if you need time to gather to see if it's possible. I've been talking to like the school board members and trying to figure out on our school budget side, just figuring out how to balance things. What do you think the capacity is? How has it been like taking on the school nurses? I know we've had several conversations with that. I've floated the idea to school board members of potentially moving the rest of those positions over to public health, but wanting to see what your thoughts and input were on that.
I will say, for sake of not getting slaughtered by my director of nursing, I will say it does come with its challenges, but we have cultivated a mighty fine relationship with DPS, and that's what we've endeavored to do all this time. We want to be good partners with them, and you know, my report coming up as far as the vacancy report will reflect, Chair Alam, that you know, we are starting to see a lot of DPS nurses coming our way, much to their demise, so to speak, but to our gain, primarily because Durham County is a great place to work. But to get to the crux of your question, we wouldn't necessarily have an issue with that. We do know that it does come with a whole lot of work and probably is going to require a tremendous amount of planning. But this is no different than what, you know, other jurisdictions do. We have the majority of the school health nurses on our team for preparedness purposes, And that was so evident during the COVID-19 pandemic. In the early stages, when we had a lot of school health nurses providing contact tracing and other duties. So with that being said, it's not something that we are averse to, but we certainly know that we would have to do a whole lot more planning and preparation to make that happen. But as it stands right now to this great board, we do have the lion's share of the school health nurses, and a few more would not hurt us. It can only help the students and the population.
Thank you, Dr. Jenkins. Yeah, because I've been thinking of, like, since the positions have come over to public health, I feel like Bell's team has done a really good job of filling them as well and getting those nurses out. I know, on DPS side, of course, like the county is able to offer better benefits and salaries that also is attracting people. So I'm just trying to think of how we can get more nurses into schools and
We certainly
without
appreciate that.
overburdening public health department.
Again, we appreciate it, and I will be a really good health director and give praise to my school health nursing leadership. Under the leadership of Director of Nursing Kiki Rayner, we have done a really good job of reinvigorating the school health nurse program. At the beginning of the fiscal year, I visited them and I met with them, and I let them know that they were my priority, and that has not changed. We had no idea the events involving DPS would transpire, but nevertheless, staying in constant contact with DPS administration, really nominating them for an award, which the North Carolina Association of Local Health Directors awarded them our Public Health Partners Award, and that was a statewide award. It just really speaks to the phenomenal partnership that we have with DPS. So we are willing to do what it takes to take care of our students and to make sure that healthcare services are provided accordingly.
Thank you so much, Dr. Jenkins. Thank you so much to the school nursing team as well.
Right. Mr. Gregorio, recognize you at this time.
Yes, thank you.
Yes,
Thank
sir.
you, Finance Director, Ms. Gwendon. Wonderful presentation as always. I don't have too many comments on my end. I just wanted to ask two questions. One regarding the capital. I did see that there was a reduction of 10,000, very topical, but if you could speak to that, and what is that reduction?
Yes, thank you for mentioning that. That was for a device that we purchased this year. That was for I'm not going to remember the name because it's a long and complicated name, but it was in the lab. And so I think the capital costs usually run through the county, and that was the one that I remember last year, because we aren't able to request capital on our end, so it was a part of our operating lines, and then it got shifted into the capital. But that was a piece of equipment. I believe it was the RFR, some machine that I'm sure somebody on the call remembers the name of, but I can get that. I can email that to you, that specific piece of equipment for the lab.
Gotcha. Sure thing. Thank you. And if you could just go to slide 10 for the fee changes. Wonderful. Thank you. So just speaking about that National Dental Services Advisory Study, just out of curiosity, what is the reason for the increase in the fee changes from a high level view? And then also, how was the expected revenue impact calculated? Was it based off of historical volume of charges or forecasted?
Yeah. So this is something that Mandy Cohen, a few years ago when she was with us here in North Carolina, was advising health departments. There's sort of a historical, sort of well-known fact that the Medicaid reimbursement rates are quite low for dental services. And so in looking at that, she had sent out, and that is something that they are looking at this time at the state level. And we've been given recent communication that that's going to be something that they're looking at. But Director Cohen sent out a memo a few years ago letting folks know that anywhere up to 75% of the numbers put out in that advisory study would be acceptable for local health departments to accept. So that was during kind of COVID times. And while we did increase a little bit here and there with our dental fees in the last couple of years, we hadn't looked kind of holistically at those fees. And so that's what our dental director did this year in presenting the 60%. So there are other counties, we did speak with other counties in our neighboring areas of how they're handling this piece. And some are going straight up to 75%. We decided to start with 60 and perhaps look at increasing in the future a little bit more, but more of an incremental approach. In terms of calculating the revenue impact, what we do is look at the difference in the fee from the current year to what it would be with that increase with the geographic multiplier for Durham. And then we take the number of times in the current year, or we looked at last year's numbers because we had a complete year for each of those services. And so kind of multiply the difference in based on what we had done on that particular service for the previous year.
Sure.
And that's how we kind of get that total.
I see. Gotcha. Would you say that 60% is conservative in terms of approach?
Yeah, I think so. Yeah,
Okay.
I think so. I think, but I think that's a good approach because our dental lobby is always bumping. And so we want to make sure we're still providing an accessible fee. But it also seems like to me from the little communication that I've received from Medicaid, they know that they have some catching up to do in terms of these rates. And so I think that the providers are really driving that. We're kind of leading and Medicaid is going to follow.
I see. Gotcha. Well, again, thank you so much for the wonderful presentation. And I'll let you know if I have any questions in the future, but you did a great job. Thank you.
Absolutely. And I'll email the exact name of that piece of equipment from last year.
That'd be great. Thank you. I'm just curious.
Yeah.
And I see Director Jenkins has his hand up, but I'm guessing it's a comment more than a question, but
just
go
one
ahead,
additional comment, Mr. Chair, and to this illustrious board. I'm so proud of the leadership team and particularly the finance administrator under her leadership. We are really taking a deeper dive into the business of public health. We know that we are a resource-rich community, and special thanks to Chair Alam and the Board of County Commissioners, but at the same time, public health is a business. And there are opportunities for us to be able to contribute more to the county's coffers by being prudent in our business practices. So again, I could not thank Micah and her staff enough for really course correcting to a certain extent and just really coming up with innovative things that we can do to bring more revenue to the county's coffers. So the only thing I had to add, Dr. McDougal.
Yes, sir. Yes, sir. We've got Dr. Ray with his hand up. We'll recognize you, sir.
Yeah, thank you very much. Just a quick question. First of all, thank you, Ms. Quindon. That was wonderful. Just if in the unfortunate scenario we get to either a 5% or a 10% cut, are there is there a plan for some type of alternative funding mechanism to close that gap that besides county operational funds that the department could go after, or is this essentially the plan and we're just going to have to deal with that until the next fiscal year, the next budget gets released?
Yeah, thanks. That's a great question. We are, some alternatives that I would say we're kind of always exploring is additional funding via grants. So, I can use the health education division as an opportunity. And I spoke to this because I think this is really incredible of them. Knowing that the OMH grant was going to be ending this year, went out and sought funding and was able to secure, and this was a few months ago, $100,000 to support. So I would say, as a department, we're kind of always on the lookout for that kind of thing. The other thing that I think is happening at a state level in this sort of era in public health is we had a lot of additional funding from ARPA as a part of COVID. And while, many of those funds, I think I'm frozen.
No, you're good.
Okay, sorry, everybody froze. I thought, oh no. So while some of those funds certainly have wound down, we do also keep hearing, okay, we got a no cost extension on this. So bits and pieces are carrying over into fiscal years. So you may feel like we've been saying for 3 years, the COVID funds are ending, but then we'll find out, it's, this piece is gonna carry on. And that's because at the state level, they're applying for no cost extensions to the feds. They're reallocating, looking at the state across the whole, okay, this area isn't spending on this particular grant. And so, that's kind of always occurring. And those tend to be, it ranges, but a few that we thought were ending for real this year, we found out, okay, we can, this one is actually going to continue and it will support one more person. So there's different scenarios like that I think that we're always, pivoting towards. And the third thing that I'll mention is just that we're really looking at our services and service fees, like Director Jenkins just mentioned. So with Medicaid expansion and so many more people being able to receive Medicaid in Durham County, that allows us to look at our fees closely and see what can be done to perhaps leverage those Medicaid dollars while still not impacting, having it be cost prohibitive, because we have 20,000 more people in our, however many more people in Durham County, I think it's 19,000 who are now eligible for Medicaid. So those are the 3 things that come to mind.
Wonderful. Thank you very much. Great job. Appreciate the presentation.
You're quite welcome. My pleasure.
All right. I don't see any other hands. So before we move on, I'll once again thank our Finance Director, Michael Gwendon, for an awesome presentation today, very informative, and more importantly, for the great work that she and her team are doing for the Department of Health and have done since she's joined the team. So thank you again.
My pleasure. Thank you.
Yes, ma'am. So we'll move on to the next item of business. We have our reports, our public health vacancy report. And we'll follow that with the NOV report and the director's report. So I'll give way to our health director to just briefly share about the vacancy report at this time.
Do we need to approve the budget?
I was just about to say.
Oh, I'm sorry.
I was just about to say we have to approve that budget.
We have to approve that. Okay, I'm sorry. So I will entertain a motion to approve the budget.
Motion to approve.
Second.
All right, it's been moved and properly seconded. Is there any debate? All right, well, we are ready for the question.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Dr. Rosemary Jackson,
Yes.
Dr. Miller,
Yes.
Commissioner Alam.
Quick question for Attorney Massey. Can I vote on this or do I abstain? Do I vote? I see Director Jenkins giving me a thumbs up.
I'm sorry. So Rod, what's your opinion?
I believe that she could vote.
Okay. Then I am an aye.
I think I'm gonna come down the street and try you on. I think you can vote, ma'am,
Okay.
but you're not tying yourself down to anything.
Aye.
Thank you, Commissioner Alam. Dr. Glover,
Yes.
Dr. Orto, Mr. Gregorio,
Yes.
Mr. Brown,
Yes.
and Dr. LaRon Jackson. Thank you.
All right, thank you. Sorry for that near critical oversight of not approving the budget, but we got that done and it'll go on to the Board of County Commissioners. So we'll move forward now with the vacancy report.
With the vacancy report, Board of Health, I will say that we did have a slight bump up from 14.9% to 15.4%. But that's mainly attributed to the fact that we've had some promotions. As I kind of alluded to earlier, I am proud to say to this board that we have been successful in filling just about all of our vacant school health nurse positions. And that has been a long time coming. So giving credit to the school health nurse team under the leadership of Director of Nursing, Kiki Rayner, that is something I'm very proud to report on. Otherwise, we've had just very few resignations. People are starting to really show up for interviews, not ghost us as much. So again, with the vacancy report, I do fully expect within the coming months for it to be a lot lower.
All right, thank you. Any questions from the board or from the audience about the vacancy report? Okay, well, we'll move on then to the NOV report, and we have Mr. Salter on the call. So if you want to just give us a brief overview of what we're looking at this month.
Yes, sir. There was still some increase, unfortunately, as you all probably noted, but I believe last meeting we discussed the phenomenon of seasonal NOVs. And the one positive thing is, as we all can tell, we're moving into the warmer weather, and some of these seasonal NOVs might come back into compliance, and we're hoping that. But there are some that have been outstanding for an extended period of time, and we're going to have, I spoke with Patrick Eaton, my on-site supervisor, and we're going to have some discussions with Attorney Massey or Attorney McKinney, and possibly, look at injunctive relief for some of these if the property owners don't make better effort to bring them back into compliance.
Okay, thank you. All right. There are no other questions about any questions about the NOV report. We'll move on to the health director's report for the month of April.
Not too much to report on, but the two that are there are certainly significant. We're very proud of our dental laboratory, dental practice, just really lifting up our dental hygienists. Had an opportunity to attend a lot of their meetings as of lately, and they do a very fine job under the leadership of Jim Harris. They run a very tight ship, and Jim was instrumental in helping us to really come up with that increased percentage for fees, because as Micah said, there's no shortage of activity inside our dental operatory, but we wanted you to really understand we have 2 public health dental hygienists that are doing a very, very good job. And then most importantly, the community health needs assessment that falls under the population health division. Marissa Mortaboy is the division leader, and Bria Miller, just really want to lift her up and let her know how much we're proud of her, the great job that she's done. Final stats, we're talking 426 pages, lots and lots of contributors, and it is now gaining traction, and this is time for the roadshow, as I like to say. A lot of people are really ready to sink their teeth into the chapters, and they're certainly eager for us to do various presentations on the community health needs assessment. I don't have to tell this board that lots of great work went into it. It's really conducted by the Partnership for a Healthy Durham in collaboration with Duke, and myself and Michelle Lynn are the primary editors or reviewers, but there are a lot of editors. Certainly want to lift up a lot of the leadership team members and members of the public health staff who contributed and edited and wrote and did all the work that's required. Out of all of that work, top 5 indicators: affordable housing, access to healthcare and health insurance, violent crime, mental health, and what we affectionately call PANFA, which is physical activity, nutrition, and food access. Those are the top 5. And we look forward to the listening sessions that are to come, to where we can get community input. But for right now, the lion's share of the work is done. It's creating the document, and we certainly look forward to reporting various iterations to this board. Mr. Chair.
Thank you. I did have one question about the dental segment of the director's report, and Director Jenkins, you or Dr. Harris, feel free to answer. But as far as the public health hygienist, I know that they're able to do prophies and periodontal cleanings. Are they also doing a significant number of sealants or other procedures that they can bill for without the oversight of a dentist? I'm just curious as to what other procedures they're able to bill for without the check of a dentist.
We do have Jim Harris on the line. I will defer to Jim on that one. Jim, are you available?
I am. Thanks, Rod. Thanks, Chair McDougall. So yeah, what they can perform those services as long as the patient is on an active treatment plan, as well as go into the schools to do the school screenings.
Okay, thank you.
Thank you.
All right. Do we have any other questions regarding the health director's report? All right. So we have we have no committee reports, but we do have a presentation regarding the lead in the city parks, an update regarding that, and Mr. Salter will also give us that presentation. So we'll give the floor to him at this time.
Okay, can everyone hear me?
Yes, sir.
Okay. Okay, excuse me. At the last meeting, there was a request for an update about lead in the city parks, and everyone here, I'm sure, has heard about this issue. And I tried to put together a presentation that wasn't too in-depth, but it just kept growing. And Director Jenkins is probably thinking, you know, I hope he doesn't take too long on this, but because I can get long-winded, but I felt like it was also an opportunity for me to touch base on some stuff that that we do that's not necessarily directly related to the parks. But my first slide is, how did we get here? So everyone probably knows this by now, but back in the early 1900s and through the 1950s, the city of Durham operated several incinerator sites across the city. And those incinerators were used to burn refuse of all types. So that possibly included materials that contained lead and other hazardous materials. When those incinerators were decommissioned, several of the sites were turned into city parks. In June of 23 last year, the city of Durham officials contacted public health and requested a meeting to discuss the findings of a report that was conducted by a graduate student from Duke. And that report is displayed here. It's called Legacy Lead Contamination in the Soils of 3 Durham City Parks. Do secondary forest organic horizons effectively blanket lead in city park soils contaminated by historic waste incineration? And those 3 parks that the student studied were East Durham, East End, and Walltown parks. He pulled samples from these parks and he used what we refer to as an XRF machine to analyze the samples. That is a machine that's commonly used in environmental health during lead investigations. And it's basically a handheld device that has a radioisotope in it. And you can put it against a material, squeeze the trigger. It sends a X-ray pulse out, and it pretty much knocks electrons off of atoms. And it's the innermost electrons that are knocked off. And when that happens, the outer shell electrons fall in and try to fill the inner shells again. And that in turn causes a reflective ray that comes back, and those rays are actually unique to different elements. So the reflection from lead atoms is not going to look the same as that for, say, copper. So that was the machine that he used, and it does work, but it does not conform to all the EPA standards and protocols that you would like to see used in a study like this. Okay, why is lead in city parks concerning? The exposure can lead to serious adverse health effects in children, to include brain damage to the nervous system, slow growth and development, behavioral problems, as well as hearing and speech problems. Children under the age of 6 are most susceptible and at highest risk. Number one, they're still developing, right? All these systems in their body still developing, but they also have behavioral issues as far as they like put stuff in their mouth, right? We all know that children from age 1 to 4 are picking things up like crazy and just sticking them in their mouth. They're chewing on things and they don't know any better, and that places them at higher risk. So this slide I included, which it actually refers primarily to environmental health. There's a lot more. This was pulled directly off a follow-up schedule when a child has been diagnosed with elevated blood lead levels. And you see at the top of this slide, I have EBLL, and that refers to elevated blood lead levels, or a CLP, what we refer to as a CLIP, and that's a confirmed lead poisoning. So from this slide, what I wanted you to take away is you can see in 2012, this guidance was at 10, and the level of lead is measured in blood is measured in micrograms per deciliter. So in 2012, the guidance said if a child comes back with an elevated blood lead level of 10 micrograms per deciliter to 19, they were considered elevated, and we would offer an investigation. Okay, if it came back as 20 or higher, the child was considered poisoned, and an investigation is required. That means that if we offer the investigation to the parent or guardian, and they refuse to allow us to do it, then we have to take legal action because it is mandatory. They have to go along with it. But what you're seeing from this slide is how the importance of lead in the environment and exposure to kids just continues to get more and more intense. And it's recognized that we need to do more and more to prevent exposure to lead. And in 10 years' time, the EPA cut these triggers in half. So EBLs now start at 5 micrograms per deciliter and go up to 9.99, and then 10 or higher becomes a confirmed lead poisoning. So I don't want anyone to take away from this that I'm minimizing the importance of this. We just talked about how the importance of limiting exposure to lead, how it is and how it continues to grow and get more and more important. But I wanted to touch base on hazard versus risk. The two primary routes for lead exposure are ingestion and inhalation. So you got to understand that the primary route for exposure in a park would be ingestion. So, i.e., a child eats contaminated soil. We just talked about smaller children are prone to put things in their mouth. If you leave them outside, they will eat dirt. However, we have guidance that's for, there's a general statute and there's administrative code that we use to regulate childcare centers. And within that, there's a section in there that talks about if we find an area that's 400 parts per million or higher in the soil around an area that children frequent or play in, you can cover it with 4 to 6 inches of mulch, or you can put sod down, or you can allow vegetative cover to grow, i.e. grass, and that is remediation for it. That's how you fix it. The city parks in the play areas have about 12 inches or more mulch in the play areas. And if you've ever been to any of the parks, with a few exceptions. There may be some spots here and there, but the majority of these parks are very beautifully grassed over. So you can make your own. I'm not making determinations for anyone, but I'm talking about a hazard versus risk. The hazard exists, but what is the risk? So when I first learned of this back in June of 23, I went straight to our lead program specialist and I said, you know, we know now that there are elevated levels of lead in some of the parks. I want you to go back and look at cases that we have identified and on a 3-mile radius around each of these parks that have been implicated, and look for, you know, oddities, look for clusters of cases and those types of things. And there were none. So there were 20 elevated cases that we identified around parks, but and 10 poisonings. There were no real clusters anywhere. And in each case, a hazard was identified within the home, not the parks. So as I mentioned earlier, in June of 23, we got a call from the city. They said, hey, public health, can you come and sit down with us and discuss this issue that we've been made aware of? When that happened, we offered to reach out to DHHS, the Occupational Health and Environmental Epidemiology Group. We have a long-running relationship with these folks. We work with them from everything from asbestos issues, from the explosion that happened downtown years ago, the CO issues at McDougal Terrace, ventilation issues. I've worked with them many times with Legionella cases and things like that. So we have a long-standing good relationship with them. We brought them in. They gave some guidance and they said, hey, we probably need to reach out to DEQ. And one of these folks had a relationship with a person with DEQ who was over the Superfunds and Superfund sites and a group called Pre-Regulatory Landfill. And that's where the PRLF comes in. And there's a link that explains what that is. And we'll touch on that in a few more slides as well. So the during the discussion amongst all three of these groups, the city, public health, DHHS, DEQ, it was determined that you could not take action based on the graduate student's report. There were protocols that weren't followed. You used an XRF instead of using spectrometry in a laboratory and that kind of thing. So the city was advised to have another survey performed. So they contracted with Mid-Atlantic Associates, an engineering group that specializes in environmental studies like this. So they did their study. And unfortunately, they did confirm that there are some issues in the parks, elevated lead levels. I added this slide just so that everybody understands that there's something called background lead levels in the environment. Lead is a natural element, right? It's out there. There's a lot of stuff that's out there. But this is a previous study that I referred to in the beginning that's outside the parks, and it's commonly referred to as the Anna Wade study. And you can Google it, it'll come up on YouTube. And she did a study back in 2020. She theorized that, hey, back in, you know, the 50s, 60s, right on into the 1980s, tetraethyl lead was added to gasoline as an anti-knock agent. And if you're as old as me, you remember some of the older cars that if you step down on the gas, it would kind of bog down and you'd hear that rattle sound. And that was knocking where the engine wasn't firing right. And it was because the gasoline wasn't being burnt correctly, and this lead allowed it to do that. But unfortunately, the emission standards weren't very high back in the 50s, 60s, 70s, and 80s. And when you burn leaded gasoline, it deposited lead through the exhaust, and it came out the exhaust, and it was deposited on roadsides. So she sampled roadsides, some of the busier streets around Durham and close to gasoline stations. And as you can see, the larger, darker dots that are along these roadsides show elevated levels of lead. This is not in the parks. This is along street sides. So this slide is included to show that you may sample in areas well outside of the parks and find elevated not blood, but elevated levels of lead in the environment. So when DEQ took a look at this stuff, they said, look, we have this group called pre-regulatory landfill, and there are some funds that we might be able to help you with. However, to qualify for us to come in and help you out with this, there are standards and there are protocols that are required that it will include and require us to do a third study, a third survey. So DEQ doesn't necessarily do this on their own. They contract out with other agencies or other companies. And in this case, they're contracted with S&ME Incorporated, and they brought them in to do this third study. So one important note from this that you need to take away from this too is there was a gap between when Mid-Atlantic did their study and when DEQ or S&ME did their study. And during that time frame, actually it was in January of 24, the EPA cut the threshold in half. So it dropped from 400 parts per million to 200 parts per million. And that's important to keep in mind because now areas that the two previous studies identified as not being high may come back high because the threshold was cut in half. And that did happen in some cases. So I put some of there are a lot of maps and things that were in these studies, and it can get very complicated. If you remember in the beginning of this presentation, we touched on Walltown, East End, and East Durham parks. Lyon Park also had an incinerator during the same time period. So this study actually includes Lyon Park as well. And this particular slide shows a map where all these borings were done, and it's just it's intense. That's a lot of borings that were and samples that were collected here. And as you can see, the way that they perform these borings or this survey, they go in and they mark off 100 by 100 foot grids or section squares, and they pull a boring from the center. And then they go out 25 feet north, south, east, and west, and they pull what they refer to as composite borings. And they're testing for more than just lead. They're testing for all heavy metals. They're also looking for VOC. So that center boring, when they pull it, they actually pull the soil out, put it in a plastic bag and seal it up. And then they wait a while, and then they open it back up and put a photoionizer in there and check it for VOCs. When you put soil in a bag like that, seal it up, VOCs by their name, volatile organic compounds, and they're usually associated with petroleum products. And one in particular that's a very, very much concern is benzene. They'll put that device in and measure it as it gases off, because if you try to get that to a lab, it's going to be gone, right? By the time you get it into a lab, it's already gassed off. So they're checking for that as well. And this one's just impressive to me because there are so many borings there. The next one, this is East End Park. And this one, the thing to take away from this is these grids that are in green, if you look at the legend, it says if it's green, it came back at 200 milligrams or less, below 200 milligrams. Milligrams per kilogram, and that is the same as parts per million. In environmental health, we speak in parts per million, but it's the same thing. And there's one small area up to the upper right that's in red, and that would be an area of concern, right? It's above 200 parts per million. Now this is East Park, and you'll see a mixture of green and red, but you see the same pattern of sample borings. And if you'll notice that some of these center borings are not really in the center, and that's due to the fact that something was in the way. It was either rocky or there was something there that they couldn't take it from the center of the grid. So that's what this one shows, and it's a good example. There's a reason I'm looking at this park as well. If you look down at the lower right corner, you'll see like a driveway down there and a building. And that is a small apartment complex. And the concern there is the close proximity. So there could be contamination that has gone over and onto that property as well. However, it's private property, so it hasn't been sampled yet. But this map shows where you've got these intersecting lines and everything, and it explains soil cover. What they found in addition to lead and other contaminants was there was waste materials that were just dumped and covered up, and they pose a hazard. So in shallow soil areas where there was a lot of waste discovered, they don't want people going in there either, because you could easily be exposed. You could get cut. You could be exposed to something that you don't want to. So that's why these maps are here. So what does all that mean? We just covered these maps, that just a handful, and there are dozens and dozens of these maps in these reports. The map that we just looked at, figure 5, it takes all the data collected for the sites and presents areas that the PRLF, pre-regulatory landfill unit, would target for a risk-based remedy with the importation of additional soil cover. They don't mention here how much soil cover, but one of the standards that I'm familiar with, the typical amount is they bring about 12 inches of soil in. And that is typically the recommendation to remediate issues like this when it comes to DEQ. Okay, so we already talked about the scenario. So this is what has been proposed so far to the city. So the areas of the sites in scenario 1, they should be cordoned off to prevent exposure of lead at concentrations that exceed the residential screening level of 200 parts per million. The city should also consider limiting access to areas of the sites in scenario 2 where there is potential to encounter landfill waste. I just touched on that, in the top 12 inches of soil in these areas. And one of the recommendations is that city may want to start with East End and Walltown parks first. And I believe that's just because it's going to be easier to get those done. There's no other reason, because the risk is the same if it came back high, right? So I think that those have less areas that need to be addressed, so they should be easier to address first. So that was pretty much what I had for this. Are there any questions?
Director Jenkins has his hand up. I'll let him go.
The only thing I'll say is to this board, thank you all for hanging in there. This is a very important presentation that I'm thankful to Chris for cultivating and presenting. I think the most important thing I want to extend to this board, as I said to you all in many emails, is that public health has done what we're supposed to do in terms of making sure that we partner with the city, making sure that we get that information out to the community from an education perspective. We do know that there are many who feel as if we ought to extend ourselves in lanes that public health should not. As he's articulated many times, we have been in conversations with the state environmental. We've been in conversations with the Department of Environmental Quality. We've been in constant conversation with the individuals who are directly responsible for what they call the Superfund. And I just want this board to really understand that we have always taken this position in this situation very seriously. I have been in constant contact with the city, particularly the deputy city manager. We have an excellent working relationship, and we are committed to ensuring that whatever remedy that the city chooses, it is in accordance with, the recommendations from DEQ's study. So it's important that I also say that a lot of the stuff that Chris went over was not necessarily commissioned by the Department of Public Health, but more or less by DEQ. But again, I just want to say thank you to Chris for that presentation. And Mr. Chair, happy to answer any questions you may have.
Thank you. So I want to thank Chris again for that very, very informative presentation, especially the historical information about how the lead gets into the soil and in our current parks and roadways. Just very informative. And I appreciate your comments as well, Director Jenkins, that just helping to remind us all that this is not an issue that the Board of Health is responsible for alone, that we have to partner with other agencies.
Yes,
So,
Dr. McDougall, one
Yes,
last
sir.
comment that I forgot to mention.
Yes, sir.
I think is important. There are surveys being conducted right now, and I think they're going to take some time to complete. But once the boundaries are actually surveyed and identified, there will be additional borings and samplings run by SNME, and after they do that, they will determine how far out the contamination goes. And if it's out close to the border, then they will start a process of going out to private property, which will take some time because they will have to get permission, and that's going to take some time. And I won't get ahead of myself because nobody knows yet just how far out it extends. But if it does, that's the plan, that they will actually venture out. So this process could take quite some time to get completed.
Gotcha. So I appreciate that as well, Chris. And I just wanted to, and I think you've already answered this, but I want to just be clear as far as the abatement, whenever that should occur. Is it typically, or is it more likely going to be where more soil is brought in to cover those high risk areas, and then grassing it over? Or is there some other? I was reading online where you can add soil and grass, sometimes concrete, asphalt. Sometimes you're taking the soil up. What is, if you can guesstimate, what is likely going to be the remediation issue or strategy that we or that the city takes on? If you care to guess at that, how will that look?
I would venture to say it will be a 12-inch cap of soil.
Okay.
Yes.
Okay. Thank you. Dr. Ray has his hand up. Go ahead, sir.
Yeah, thank you. Chris, great presentation. You took my knowledge level of this topic from 0 to something above 0, and I really appreciate you going through that detail. My question is just around the current status of these parks. I haven't been to all of them. I have been to Lion, and I recall seeing big walls and fences up there, but not over the whole park. And I think when you went through the topographical diagram, there was an area, to memory serve, that was red, but I don't remember that being behind the fence. So like, what's the status now? And is there anything, a public commenter last time made a mention about just communication and signage. Is there anything that we can or should be doing regarding the current status of just the public knowing and having access to this information in the areas of these parks?
Well, I do know that there has been additional fencing and signage put up since the SNME study was done. And hopefully, I can't speak to it 100% for sure because I haven't been out recently. Now, public health did go out and survey the parks along with DHHS and DEQ, and the SNME were involved as well. And since then, since SNME study, there has been additional recommendations made, like I referenced to at the end of the presentation, to the city to add additional fencing. And that's about all you can do until you get to the additional soil phase. We have, and Director Jenkins can attest to this, I'm sure we've done a lot of stuff, and there's a lot of involvement around lead. I mean, we've got this thing called Clean Water for Carolina Kids that has now transitioned in Clean Classrooms for Carolina Kids, where water sampling and other sampling's been going on for a couple of years now. We stood up the clinic. The nursing staff stood up a clinic and offered blood lead level testing. We've accompanied, there was a 1940s vintage home that was burned back in July at 1415 Bivens Street, and the siding had lead paint on it, and that paint went up in ash and was deposited around surrounding home sites. And the people knew about the parks, and they had concerns that, you know, now there was lead in their yards. We were involved in surveying those and recommending cleanup with that. And it goes on and on. We're now involved with municipal water in an effort that the EPA has mandated that all lead pipes and fixtures that are in the municipal system be identified and removed. So there's a lot that we've been doing, and I'm just touching the surface of it. There's a lot more that we've done. And there is education. Our PIO, Alicia Smith, has updated many things that are on our websites. There was a public service announcement that Dr. Jinks and one of our health education staff did. So we are trying to get the word out there. One aspect of this, again, that I want to go back to was, I hope everybody can look at this and make their own decision, but there is a hazard. We know there's an identified hazard, but what is the risk? And you know, and I referenced a rule set that we use when it comes to the identification of a hazard in a play area or area frequented by children. And it's 4 to 6 inches of mulch or vegetative cover, or like Dr. McDougall referenced, you can pave over an area, but ideally the 4 to 6 inches of mulch. And like I said, the play areas in these parks, from what I have observed, have about 12 inches or more of mulch on them. And they're very beautifully grassed over. I mean, these parks they're a jewel as far as I'm concerned, as far as recreation goes in this city.
Chris, thank you very much. Thank you for educating us on this topic. I agree that our parks are a wonderful public asset, and appreciate your time and effort in putting all this together.
Thank you.
Absolutely. Thank you so much. Any other comments or questions for Mr. Salter regarding our presentation? All right. Well, thank you. We're going to move on. We've got our new business. We've got the 3 budget amendments totaling about $1 million, if I'm not mistaken, a little over $1 million. So I will give way to our director to present those to the board.
Thank you again to this board for hanging in there. I promise to be very quick. First budget amendment, the board is requested to approve a budget ordinance amendment to recognize funds in the amount of $50,000 from the North Carolina Department of Health and Human Services, Division of Public Health's Local and Community Support Section. These funds are going to be provided through budget receipts transferred from the state's ARPA Temporary Savings Fund and are available through the General Assembly's 2023 Appropriations Act, HB 259, which provides $50,000 in the form of a grant for each year for 2023 and 2025 fiscal biennium. The good thing about this one is it rolls over. Although we're getting it a little late in the game, it will roll over and we'll get an additional $50,000. I could get on my soapbox and say this is not nearly enough, because the work that we do in public health, the General Assembly needs to recognize that we certainly need a lot more money from the state to keep our citizens safe. But I'll leave it at that. The next budget amendment is the board is requested to approve budget ordinance amendment to recognize grant funds in the amount of $241,116 from the Division of Child and Family Wellbeing, North Carolina Department of Health and Human Services for our dying programs implementation. Of the $1,355,391 total contract amount, $1.1 million was previously approved by the Board of County Commissioners during fiscal year 24 budget cycle. These funds will be in addition to previously approved staffing and programming. Funds will also be used to support a new FTE nutrition specialist position to expand dying programming in the community settings per the approved staffing. So again, this is good money, good way for us to continue to educate about food with our dine program. And finally, the board is requested to approve budget ordinance amendment to allocate $880,475 of the opioid settlement funds awarded to Durham County. As I've said to this board before, the county management executive team has designated public health to be the purveyor of these funds, and funds will be inside public health's coffers. Durham County Department of Public Health will use the funds to advance two strategies identified in our Exhibit A of MOA between the state of North Carolina and local governments on proceeds relating to the settlement of opioid litigation, collaborative strategic planning and recovery support services. Specifically, we are going to get two positions from these funds. One's going to be an overall opioid program manager who's going to be focused on overseeing the development, administration, budget, grant management, and reporting for Durham County's opioid settlement program. The second is going to be housed in our Health, Education, and Community Transformation Division. These funds will also be used to continue the community linkages of care, peer support program, as it was developed to connect individuals who are struggling with substance use disorder with comprehensive evidence-based care, which acknowledges social determinants of health and responds to current housing challenges. I'd like to say that they do a mighty fine job, and we are looking forward to these funds having a greater impact in Durham. That is all I have, Mr. Chair.
Thank you, Director Jenkins. Do we have any questions or comments regarding those amendments? If not,
yes, I just had one question.
Go ahead. I'm sorry.
Yes, thank
There
you,
you go.
Dr. McDougall. Thank you, Director Jenkins. This actually might be a question for Finance Director Ms. Gwendon, but for the opioid settlement funds, $880K, is that already baked into the $343K from the reallocation request from the budget?
No.
It'll be on top. Okay, gotcha. So would we potentially recognize more additional revenue?
Yes, sir.
Okay, great. Thank you.
We have approximately, at present, anywhere in the neighborhood of 2.5 million that we are doing our best to make sure that we get out, but we have to start off with getting these positions funded so we can start moving the money. So thank you for that question, Mr. Gregorio.
I see. Thank you.
All right. Any other questions? Okay, well, I'll entertain a motion to accept these amendments.
Motion to accept.
It's been moved. Do we have a second?
Second.
All right, it's been moved and properly seconded. Is there any unreadiness? Any debate? Hearing none, we're ready for the vote.
Dr. McDougall,
Yay.
Dr. Ray,
Yes.
Dr. Rosemary Jackson,
Yes.
Dr. Miller,
Yes.
Commissioner Alam, Dr. Glover,
Yes.
Dr. Orto,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown,
Yes.
and Dr. LaRon Jackson. Thank you.
Thank you. Passes unanimously. Okay, so the next item is, do we have any requests for agenda items for our next meeting? Any agenda items that you'd like to see at our next meeting? All right, I don't see any hands, so we'll leave that to our director and his staff to put together our meeting. Any comments, informal discussion that our board or anyone else in the gallery would care to bring up?
Actually,
right.
I
Go ahead.
paused. I'm still thinking about it, but I'm involved again with corrections part-time. And so I'm interested. I know, do we still have Mr. Clayton working in terms of helping inmates that are released transition?
NC Fit?
Right, yeah, with their healthcare needs.
Unfortunately, Mr. Clayton is no longer with us, but he's still with Fit. He has graduated from local to state.
Oh, I see. Yeah, he's good.
But more than happy to provide an update on Fit. They continue to do great work. They're expanding their reach. So we'd be more than happy to get that for you, Dr. Jackson.
Okay, all right, great. And it doesn't have to be a big thing, but
Yes, ma'am.
yeah, thanks.
Awesome. Thank you. Anything else for next meeting? All right. Well, I will entertain a motion to adjourn.
Motion.
Second.
All right. It has been moved and properly seconded. I don't think we're going to have any unreadiness.
It was
But
a
I
good
will-
meeting,
I will-
longer
I
than
will
usual, but it
pause.
was good. It was good.
Yeah. Very informative for sure.
Yes.
So I don't see any debate or don't hear any debate regarding our adjournment. So we are ready for the vote.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Dr. Rosemary Jackson,
Yes.
Dr. Miller,
Yes.
Commissioner Alam, Dr. Glover,
Yes.
Dr. Orto,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown,
Yes.
and Dr. LaRon Jackson. Thank you.
Thank you. Thank you, folks, for hanging in for a slightly longer meeting today, but again, very informative. Hope
Yeah,
everyone
it was
enjoyed the
good.
information. Yeah. Great discussion. All right. Well, we'll see each other again, hopefully next month.